Hello everyone. In this video, we are going to discuss about how to treat the Whitish vaginal discharge. For that, first you must ask about the discharge, the duration, color, quantity and then time. This will give the idea about the disease and its progression. And you should ask for the associated symptoms. Is there any lower abdominal pain? The relation with the menstrual cycle, when it comes, when it goes, everything, and itching over the area, and the smell of the discharge and its association with the coitus. You should do a per speculum and a per vaginal exam. After the examination, you will decide whether it is a cervicitis or vaginitis. Okay. Sometimes what happens is that it will be a normal vaginal secretion which is excessive in nature. For that, you must make sure that the patient is maintaining the hygiene and give her the reassurance and tell her that it's normal. Avoid the medicated pessaries, and you can also give some placebos. For example, the multivitamin tablets and ibuprofen and paracetamol combination drugs 2 times per day for 5 days, which are anti-inflammatory in nature. Coming to the vaginitis part of this discussion, if the discharge is yellowish frothy, then it is of trichomonal in origin. For that, you need to give tablet oronidazole or tablet tinidazole 2 times a day for 5 days. Make sure that you are treating the husband also. And you can add the povidone iodine pessary night for 7 days. And if the discharge is thick, curdy white with plaques and congestion, then it will be of candidial in origin. For that, you need to give the nystatin pessary, and it should be deep into the vagina for every night for 2 weeks. Or else you can try the clotrimazole pessary night for 3 days. You should add one more tablet, that is fluconazole 150 mg stat for every week for 3 weeks. Okay, this must be also given to the husband. Suspect that there is a mixed vaginal infection of bacterial, fungal and trichomonal, then you must give tablet tinidazole and also the ciprofloxacin and norfloxacin combinations for 2 times for 5 days, and add the azostat kit that contains fluconazole and 2 tablets of tinidazole. You must make sure that you will check for the blood sugars to rule out the diabetes and HIV tests to rule out the AIDS, because these things are common in them. And if you suspect that there is some cervical erosion or endocervicitis, then cauterization of the cervix is important, and you can also add povidone iodine pessary night for 10 days. So then going to the leukorrhea, that is whitish vaginal discharge with pelvic pain and tenderness. This suspects us for pelvic inflammatory disease. For that, you should add tablet ciprofloxacin and metronidazole combinations 2 times a day for 5 days. Okay, and you can add the anti-inflammatory substances. Those are the tablet, ibuprofen and paracetamol combinations 2 or 3 times per day for 7 days, and do pelvic ultrasonography, because the pelvic inflammatory disease has its own significance. To have a good prognosis, we should know what the condition is. Okay. So if the discharge is associated with the dysuria, it will suspect us to the urinary tract infection. For that, you need to give antibiotic. That is, you can add tablet norfloxacin 400 mg, 2 tablets stat, that is single dose. And also you must give a investigation for smear of urethral discharge for gonococci. This is about treating the Whitish vaginal discharge. So if you have any doubt, please drop down then in the comment box.